important things to think about than skin prep? Maybe. But the reality is that skin prep is probably the biggest little thing you can do for a patient. When you think about the fact that patients who develop a surgical site infection are 2 to 11 times more likely to die than operative patients who don't get an SSI, well, that's a big deal. And when you consider that 40 to 60% of SSIs are preventable, it's pretty clear skin prep matters. And to show us how much it matters, we've got a great canvas here. This is Colin. It's okay to clap. Yeah. And here's our expert on the subject of skin prep, our clinical consultant, Leanne, our nurse from Care Fusion. She gets a hand too. Well, it looks like we're prepped and ready. Well, I guess you're not prepped, but you will be. So who's ready to see how this is done, huh? So we're here today to demonstrate the proper procedure for using ChloroPrep skin antiseptic. First, I'd like to talk a little bit about what makes ChloroPrep different from iodine-based products, like the paint and scrub 2-step process or iodine alcohol 1-step applicator. Those types of skin prep solutions have been used for years and years, and you're probably familiar with the paint-on application. Today, we'll be demonstrating the application of ChloroPrep, which is the only 2% chlorhexidine gluconate, 70% isopropyl alcohol combination product available in the United States in a 1-step applicator. There are several reasons ChloroPrep is the preferred patient pre-operative skin prep for minor or major medical procedures. There's the unique formulation, the aseptic technique applicator, then there's the mountain of clinical evidence showing its efficacy. And while we're getting set up, here are some of the basics about ChloroPrep. The 2% CHG, 70% IPA formulation acts fast on a broad spectrum of bacteria. And there is published clinical data to support persistence for up to 48 hours. You might see the tint wash off, but the CHG continues to fight bacteria for that entire time. And the reason that formulation gets into the skin so well is the specially designed applicator. The soft sponge, using a gentle back and forth motion, allows the solution to penetrate the first 5 cell layers of the epidermis. And the applicator design eliminates direct hand-to-patient contact, helping to prevent cross-contamination. It's a proven system, the formulation and applicator working together to support infection control guidelines to help reduce the risk of BSIs and SSIs. This system has been proven by numerous studies to be more effective than 2-step iodine paint and scrub methods or 1-step iodine alcohol products at reducing the overall bacteria and wound contaminants from different locations in the body. Trust me, the bugs do know the difference. For instance, the 1-step povidone iodine alcohol formulation just immobilizes skin bacteria, but ChloroPrep is killing it. Also, those iodine-based products take up to 2 minutes to dry and begin releasing the free iodine that starts acting against the skin bacteria. Povidone iodine may take up to several minutes to reach maximum effect. ChloroPrep starts working immediately. Are you ready to get started?
I'm ready to get started.
Great, great. Okay. Now, any thoughts on where we should prep our willing participant here? Maybe the leg, the arm? Well, I guess it's already exposed, so we'll just do the chest, huh? Today, Leanne is using the 26 milliliter ChloroPrep applicator. I should also mention that ChloroPrep can be used on many minor and major procedures, and there are smaller volume applicators. The highlight orange tint for lighter skin tones and the scrub teal tint for darker skin tones are very helpful in identifying the area that has been prepped. Okay, so First, we pinch the lever, just once, and that releases the antiseptic into the sponge. You can see it distributing through the sponge. After the solution is partially loaded into the sponge, just gently press the applicator against the treatment area to make sure that the solution is evenly distributed through the sponge. Okay, since the thoracic region is a dry site, use the gentle back and forth strokes to cover the entire area. And you do that for 30 seconds, moving out from the incision site to the periphery of the surgical site. For a moist site, like the inguinal fold or axilla, you would use the gentle back and forth motion for 2 minutes using the same pattern. And then for either a wet or a dry site, allow 3 minutes to dry. Okay, it's really important to allow 3 minutes to dry. So, as we're waiting for that break, we can talk about a couple of other important points about this. If you notice, Leanne does not use concentric circle strokes with the application. She's using gentle back and forth motion. The analogy she told me before the show is that you wouldn't vacuum your floor in one direction. You would go back and forth. It's the same deal with skin prep. Using the back and forth motion ensures that the solution penetrates into the first 5 epidermal layers, where 80% of bacteria lives, and into any cracks and crevices. Now, before you drape the area before the procedure, make sure that the 3 minutes have passed and the solution is completely dry. ChloroPrep contains isopropyl alcohol, and just like any other alcohol-containing product, you need to take fire safety precautions. Don't drape or use any ignition source until the solution is completely dry. Make sure you allow even longer if the solution is in the patient's hair. Definitely don't allow the solution to pool, and remove any wet materials from the area. ChloroPrep keeps on working in the presence of blood, serum, and biomatter. Those things neutralize the antimicrobial action of iodine. I don't know about you, but most of the surgeries I've seen involve a lot of blood, serum, and biomatter. I just have a couple of other points as we're waiting for our solution to dry completely. The reason we're so serious about skin prep is because it really matters to patients' health and to holding down costs related to SSIs. As we said at the start, 40 to 60% of all SSIs are preventable. And those infections have a very high cost, both in terms of money and in terms of patient mortality. We're also very serious about the combination formulation of 2% CHG and 70% IPA in ChloroPrep. More than 11 evidence-based guidelines support using it. And those recommendations are backed by more than 35 studies showing the efficacy of ChloroPrep following a variety of procedures. Plain and simple, it's supported by clinical evidence and has been proven to outperform other prep methods. Okay, just about up. Can we have a big hand for Leanne and our patient Colin, who was fabulous. So we do have just a couple of moments for any questions. I'm sorry, say that again? For head and neck surgery, we have a question.
Yes, so the question was, can you use this applicator on head and neck surgery? The answer is no. It's actually on the back of the label. It's not that you can't use ChloroPrep for those type of procedures. It's that it's simply a volume issue. This is too much volume,